But what we wanted to hear now is from Dr. Rob Grenfell. And interestingly, a few years ago, the Bus Association Victoria, which is a member of the Bus Industry Confederation, undertook a study in Melbourne, which identified ultimately that people who use public transport on average get 41 minutes a day of physical activity, walking to and from and to the public transport station and to work, compared to car users typically driving to work who got about 8 minutes incidental activity. And so to give us a bit more of an insight into active and public transport and health, I'd like to invite Dr. Rob Grenfell to the stage. Rob is the National Director of Cardiovascular Health at the Heart Foundation. He's held a whole range of roles over many years in the health sector, but to give us a bit of an insight into the importance of active and public transport to health, I'd like to invite Rob to the stage just as his main meal gets served. Thanks, Rob.
Thank you so much, Michael. Minister, Shadow Minister, Senator Rhiannon. Why is a health organisation here? We're going to explain that. Thank you for the support of the bus industry that has given our collective crusade to get the nation moving towards greater participation in walking, cycling and public transport. Last year, Minister Albanese made the astute observation that obesity is overtaking smoking as the leading cause of burden of disease in Australia. Now, whilst our figures show, and these are based on 2003 data, put smoking as the leading preventable cause of death and disease, most recent research from Western Australia has put obesity above smoking, but third is physical inactivity. And this indicates that our national response to obesity and physical inactivity should be as every bit vigorous as the wonderful work that we've had to tobacco control. Whilst the health impacts of overweight and obesity are well recognised, we tend to underestimate that impact of physical inactivity. And here we are forever indebted to the bus industry for providing the world with the evidence that links inactivity to ill health. So it's highly appropriate that we're here talking about this. This year marks the 60th anniversary of the publication in The Lancet of the most important study on physical activity ever done. It was conducted by the late, great Professor Jenny Morris, who, in the 1940s, wondered why London bus drivers had a much higher rate of heart attack than the conductors. How many drivers do we have? How many conductors? We don't have conductors anymore. He looked at the heart attack rates of the sedentary bus drivers compared to their colleagues and were found to be on their feet all day, collecting fares in London's iconic double-deckers up and down the stairs. Professor Morris found that the bus drivers were twice as likely to have heart attacks, age for age, than the conductors. It was a result so profound that it wasn't believed until further studies conducted by Morris found similar patterns between sedentary and non-sedentary occupations. Today we have an abundance of activity around this research question that inactivity causes poor health. Whilst this evidence is robust, policy responses in the Western world remain indifferent. Tragically, more than 16,000 Australians are estimated to die prematurely each year because they are insufficiently physically active. The cost to the community is enormous. It's been identified in a study conducted in 2007 to be almost $14 billion a year. Productivity costs amount to more than $9 billion a year, or 1.8 working days per employee per year. The Heart Foundation recommends an incredibly modest 30 minutes of moderate intensity physical activity, such as cycling or brisk walking, on most days of the week. And the Heart Foundation tells us that people who are physically active on a regular basis tend to have improved long-term health, be less likely to have a heart attack, have a healthy blood cholesterol level and a lower blood pressure. Importantly, they are more able to manage their weight. It's little wonder that Jenny Morris argued 20 years ago that physical activity could be today's best buy in public health for Western cultures. And we know that one of the best and easiest ways of building physical activity into our busy lives is through active travel, walking, cycling and taking public transport. Study after study supports this conclusion. For example, the Copenhagen Heart Study, which involved more than 30,000 adults, found that cycling has a strong protective function. Even after adjustment for other risk factors, including leisure time, physical activity, those who did not cycle to work experienced a 40% higher mortality rate than those who did. The fact is that if it were invented today, physical activity would be regarded as a miracle medicine. Being active for 30 minutes a day reduces the morbidity and mortality from premature heart disease. It reduces the mortality after a heart attack. It defers the development of diabetes. It's one of the most effective ways of controlling high blood pressure, and it improves the strength of your bones. In addition to this, for our elderly population, it improves the balance, coordination, mobility, strength and endurance. That means the elderly can stay at home, self-caring much longer. And associated with this is the raised self-esteem and the psychological well-being. So while connection between walking and cycling and better health are obvious, the public transport is right up there too. And we know that people who use public transport have a greater chance of getting their recommended daily level of physical activity during their travel. As Michael mentioned, research commissioned by the Bus Association of Victoria makes this point in spades. Analysis of household travel data from the Victorian Integrated Survey of Travel and Activity found that people who used public transport on a particular day spent an average of 41 minutes walking or cycling as part of their travel. This is 5 times more physical activity than those who are only using private transport. On average, only spend 8 minutes walking or cycling for transport. That, of course, is our outer suburbs of our major cities. It is critical that we all understand the vital link between transport and land use, policies and health. By getting people to change their travel behaviour, especially for the plethora of short trips that are currently made by car, we could achieve significant health benefits by doing this. To achieve this requires just 30 minutes of moderate exercise on most, if not all, days of the week. Not a very hard pill to swallow. In other words, we're asking people to be inactive for, well, we're actually asking people who are actually inactive for 23 out of and a half days. Now, let's put that another way. We're asking 30 minutes of your 24 hours in your day to put that to physical activity. Not a very big ask. And that would avoid a significantly large number, we're not talking small numbers, a large number of heart attacks, strokes, causes of diabetes, cancers and other health conditions. We know that people who use their legs for transport for all or part of their journey achieve amazing health benefits. The trouble is, we've forgotten how to use our legs in a meaningful way. Active travel is not the complete answer, but it is a big part of the answer. That's why I've been delighted to see the federal government become increasingly engaged in the active travel area. The Walking, Riding and Access to Public Transport report is a superb green paper and gives us hope for the future. I sort of reflect, congestion of your cities is like congestion of your arteries. It's not good for your heart health. Now, we're pleased to see the significant and ongoing interest in this agenda from the Coalition. The Greens, of course, have a long history in this area and deserve credit for that too. We very much look forward to the response of all the major parties to the 2030 report and your plans for future investment in the health and wellbeing of all Australians by fostering a significant change in travel mode. I'm generally delighted that the government, the opposition and the Greens have taken such a close interest in this report. Our mission has been simple, to get the federal government to grow its investment in infrastructure, programs, policies that will get people to walk, cycle and use public transport, buses, trams, trains or ferries to meet their everyday transport needs. The groups that comprise the 2030 task force all come from different perspectives, but we have common goals to increase the use of buses, ferries, trams, trains, bicycles and that all-forgotten form of personal mobility, our own 2 legs. Thank you so much.